We are Group 2 and we will be presenting on urine analysis.
I am Shanike Bright.
I am Charmaine Walker.
I am Tanisha Campbell.
And I am Tashana Lewis.
Good day. I am your host, Tashana Lewis, and today in studio we have with us Dr. Shanna K. Barrett and nurses Charmaine Walker and Tanisha Campbell.
Welcome again. It's good having you here, doctor and nurses. So today we'll be discussing urine analysis. So in general, what is urine analysis?
Well, it is used for detecting infection, kidney function issues, diabetes, hydration status, and other medical conditions.
Okay. And there is a thing they say about urine and glucose in urine.
And the presence of glucose in the urine is called glycosuria or glucosuria. Normally, the kidneys filter glucose back into the bloodstream, but when blood glucose is too high, the kidneys fail to reabsorb it, and it can often relate to diabetes. Patient preparation. Patients are usually asked to fast 4 to 6 hours before the test. Some medications can affect the color or reading, so we write them down. We also avoid stimulants like tobacco and coffee before collection, as they can interfere with results. Sample handling. Glucose should be tested immediately because bacteria in urine feed on sugar. If the sample cannot be processed right away, it should be refrigerated. For 24-hour collections, preservations may be used to prevent breakdown of glucose. Glucose testing procedure. The patient washes their hands, cleans the genital area, and collects a midstream urine sample. We dip the reagent strip into the urine, remove excess liquid, wait for the correct time, and compare the color to the chart. This gives us a reading of how much glucose is present. And here is an example of how the test is done for both female and male. Interpretation. In a healthy person, urine should contain very or little glucose, so less than 0.8 milli. So for the normal range, it is less than 0.8 millimoles, and trace amounts may appear after meals or during pregnancy, which is between 0.8 to 2.7 millimoles. Moderate or high levels usually point to diabetes, 2.8 to 13.9 millimoles, diabetes mellitus, mild or moderate. Very high levels can indicate uncontrolled diabetes or severe hyperglycemia, which is more than 13.9 millimoles. Significance to health and illness. In treatment and healthcare management, dipstick testing helps to monitor effectiveness of diabetes therapy, also identify early complications, for example, diabetic ketoacidosis. It is useful in special situations such as pregnancy screening for gestational diabetes, routine health checkups, and as a part of preventative and primary care. The test supports patient education and long-term metabolic health monitoring.
These normally prevent glucose loss. If it appears in the urine, sugar in the blood is too high, and that is called glycosuria.
Okay. So doctor, give us a little insight on urine analysis, picking up from where Tanisha left off.
Okay, so basically, urine analysis it just provides an overall health diagnosis as it helps to diagnose UTIs, which is urinary tract infections. It also flags potential issues such as kidney disease or renal function, liver problems, and also diabetes. So with urine analysis, it examines the color of your urine. It also measures the chemical composition. such as what is in your urine, such as the pH, the glucose levels, protein, and the ketones. Also, there are microscopic elements also including your protein, such as bacteria, cells, and cysts. Okay, so before we move on to like the further components that can be found in the urine, we should definitely know about one big thing in ketone analysis. So there's this thing called the diabetic ketoacidosis, aka. So when your diabetes is not under control, meaning the body cannot use sugar, it begins to break down the fat rapidly to use it for energy instead. And this is very dangerous.
I heard you mention the color of urine. So if my urine color is too dark, does that mean I have an infection?
No, when your urine color is too dark, it doesn't necessarily mean you have an infection. It more likely means that you are dehydrated and you should drink more water.
So what's about ketones in the urine? Because I was told that ketones appearing in your urine is a sign that your body is using fat instead of glucose. So explain that a bit more for me.
Okay, so in ketone analysis, your body is burning fat to use for energy. And this happens when your body has little to no sugar. So it could mean that you are on a keto diet or you are fasting.
Urine analysis can reveal several important diseases even before symptoms appear. These diseases include diabetes, kidney problems, and liver disease. First, and one of the most important, is the visual examination, which focuses on the color and clarity of the urine. Urine that is clear and ranges from pale to yellow is considered normal. An amber to honey color suggests inadequate hydration. Orange urine can indicate liver issues but may also be caused by the consumption of highly pigmented foods, which is usually harmless. Pink to reddish urine can signify the presence of blood or the ingestion of dark red foods. If caused by blood, it could be a sign of kidney disease, infection, or, in rare cases, a tumor. Therefore, persistent reddish urine always requires further investigation. Clarity is another visual aspect. Normally, urine should be clear. Slight cloudiness can also be normal in many cases. Cloudy urine could be due to pus from a urinary tract infection, crystals from kidney stones, or proteins resulting from kidney damage or after viral infections like the common cold and flu. Prominently foamy urine indicates the presence of proteins, which suggests kidney disease. However, if a person urinates with a strong stream after holding it for a prolonged period, foamy urine can be considered normal. The second important measurement is pH, indicating whether the urine is acidic or alkaline. A pH below 5, common among individuals who consume more proteins and fewer vegetables, indicates a higher risk of kidney stone formation and may signal existing kidney stones. A pH between 5.5 and 6.5 is considered normal. Alkaline urine, with a pH above 7, may indicate a diet rich in vegetables and citrus fruits or be common among vegetarians. It can also increase the risk of calcium phosphate kidney stones. A very high pH, above 8, can be a sign of a urinary tract infection, as some bacteria produce urease, making the urine alkaline. Another measurement is specific gravity, which assesses the concentration of salts and other substances dissolved in the urine. High specific gravity can indicate dehydration, high glucose levels, or diabetes insipidus. Conversely, low specific gravity or less concentrated urine can suggest overhydration or, in some cases, diabetes insipidus if the person drinks excessive amounts of water.
What does protein have to do with urine analysis?
Okay, protein in the urine is called proteinuria, which is excess protein in the urine. Healthy kidneys do not let albumin pass through, and protein in the urine leads to a result of kidney filtration damage.
But there was once I heard there's this thing associated with proteinuria. It has to do something with pregnancy. What is that?
In urine, protein is essential for body growth and cell repair. Normally, healthy kidneys prevent significant protein loss in urine. Patient preparation. So avoid strenuous exercise 24 hours before testing can cause temporary proteinuria. Inform your healthcare provider of all medications, and there's no special dietary restrictions. Sample collection and handling. So we could use a fresh urine specimen, random or first morning void, midstream clean catch technique to avoid contamination. 24-hour collection may be ordered for quantitative analysis, and samples should be tested within 1 to 2 hours or refrigerated. The protein test can be done by the dipstick method, which uses reagent strips with color indicators, bromophenol blue, sulfosalicylic acid SSA test, confirmatory test causing protein precipitation, or a microscopic examination. Result interpretation: negative or trace, normal, less than 10 mg. 1 positive, 30 mg, mild proteinuria. 2 positive, 100 mg, moderate proteinuria. 3 positive, heavy proteinuria. 4 positive, more than 2,000 mg, severe proteinuria. Its clinical significance: it helps to identify kidney disease, hypertension, diabetes, and pregnancy.
Protein plus high blood pressure in pregnancy leads to medical emergency.
So you're saying if I have high blood pressure and high protein levels in my urine, that's what causes proteinuria.
That protein, no, it is called preeclampsia.
Okay, it's called preeclampsia. We'll be taking a short break. After the break, we'll continue.
Hey, wait, hold on a second. Your tag shows protein levels are off the chart. What happened?
Yeah, they said I've been leaking too much protein lately. I was told to warn the owner before it gets worse.
That's serious, but we can't just let you go out like this. The owner needs to notice something's wrong. What are we gonna do now? Okay, wait, I got something. All right, here's what you'll do. Take this red juice. Once you're out, spit it out. It'll make you a bit red. That's enough to alert the owner. And this too. It'll give you that strong ammonia smell. That'll really get her attention. Wait, I think something's missing. And this, I've been keeping it for months. Guess it's time to give it away. Once you're out, use it to blow bubbles. That should be enough to warn the owner something critical's wrong.
Oh my god. Why is my urine so foamy lately? Am I having a UTI?
Foamy urine can happen when protein leaks into the urine, a condition called proteinuria. It usually means the kidneys aren't filtering properly. Sometimes it's linked to high blood pressure or diabetes, but it can also show up with UTIs or even dehydration. It's good you noticed early. We'll run some tests to be sure.
Welcome back. It's time to put your scrubs on and your gloves on. We'll be doing a quick demonstration.
Okay, so now we'll be doing a quick demonstration of how to test for glucose, specific gravity, ketone, and protein in your urine. We have a sample here, so we're going to take the dipstick and insert it. Here it is, and then we're going to compare it to the chart. So here's the chart. So as you can see, protein is still green, so there's no protein in the urine. There's no blood in the urine. Specific gravity, there is none. There's no ketone in the urine, and there's no glucose. So your urine concentration is negative.